So hello, everyone. Welcome to our webinar hosted by the American Public Human Services Association in partnership with Binti. Today's webinar topic is creating a kin-first approval process, leveraging the new federal kinship regulations to rethink support, engagement, and approval. Next slide, please. So my name is Adrian Saldana, and I'm an organizational effectiveness consultant at APHSA. I'd like to take just a minute to share with everyone the work we do for and with our members. APHSA represents state, county, and city human services agencies from across the country. We're a bipartisan organization with a focus on building common ground and generating practical solutions that work for people and communities. Next slide. So we aim to advance the well-being of individuals, families, and communities through three core channels: influencing modern approaches to sound policy, building the capacity of public agencies, and connecting leaders to accelerate learning and generate practical solutions. Our vision is one of thriving communities built on human potential. Next slide. So speaking of connecting members, I want to make sure that everyone knows about the APHSA conferences that we're hosting in 2024 in Arlington, Virginia, Portland, Oregon, Aurora, Colorado, and Albuquerque, New Mexico. While these may seem a ways off, we have already opened the call for proposals for our National Human Services Summit, and our other conferences will have their calls for proposals launching in the coming weeks. Visit the events page at aphsa.org throughout the year to learn more about these conferences, including registration dates and speakers. So just a couple housekeeping items. This webinar is being recorded and it will be circulated shortly to all registrants. During this webinar, we're requesting that you put your questions for our presenters in the Q&A panel. We will try to type responses to as many as possible live, but we'll have time at the end to answer questions. So now it's my pleasure to introduce our panel moderator, Felicia Kukura, co-founder and CEO of Binti.
Thank you so much, Adrian, and welcome everyone. We have a tremendous panel today, some of the world's thought leaders in supporting more children to be cared for by kin. I'm honored to be moderating. We have over 600 registered attendees today, so there's a ton of interest in this topic of shifting toward a kin-first approach, which is awesome to see the energy around this, and really excited for the conversation today. So I'm going to go ahead and give quick introductions to our panelists. So first, Kevin Campbell. Kevin is the co-founder and CEO of Pale Blue. He's a pioneering figure in American child protection, children's mental health, healthcare innovation. Pale Blue is a collaborative initiative and focuses on disseminating participatory methods exploring the intersection of equality, economics, and the environment for human health, flourishing, and justice. Kevin's strategies, family finding and family seeing, are widely adopted in North America, Australia, and Western Europe, catalyzing efforts in responding to critical issues. His impact extends to transforming family engagement practices globally, resulting in legislative recognition, inclusion in federal bills. Notably, Kevin played a crucial role in the successful lawsuit on behalf of separated families at the U.S. border and supports initiatives promoting whole person, whole family, and whole community health. His collaborative efforts include a truth-telling and child welfare project, addressing family separation harms, and he continues to advocate for radical reform in child protection, children's mental health, and equitable health care. His influential work has been featured in CBS 60 Minutes, Wall Street Journal, New York Times, Time Magazine, and various international publications. Welcome, Kevin. Really excited to have you on the panel.
Thanks, Felicia. It's fun to be here. Thank you very much.
Great. And next we have Marina Neitz. Marina is the co-author of the new book, Hack Your Bureaucracy, is currently a partner at Layer Aleph, a crisis engineering firm that specializes in restoring complex business systems to service. She is a fellow at New America's Practice Lab, where she works on improving America's foster care system through Resource Family Working Group and Child Welfare Playbook. She was most recently the Chief Technology Officer of the U.S. Department of Veterans Affairs under President Obama, after serving as a senior advisor on technology in the Obama White House and first entrepreneur in residence at U.S. Department of Education. She serves on the advisory boards of Foster America, Smartsheet, and Think of Us, created a Task Tackler, the personal productivity app for type B personalities, and previously authored the book Business Efficiency for Dummies. She lives in Seattle, and she was part of a large of the coalition that was very involved in pushing for these new kinship standards and instrumental in shaping them. Welcome, Marina. Really excited to have you.
Excited to be here. This is my favorite topic.
Awesome. Next, we have Stephen Olander. He is a senior director of strategic policy initiative at Think of Us, a research and design lab for child welfare focused on fundamentally transforming the system so that people with lived experience are at the center of designing, imagining, and building. Prior to joining Think of Us, Stephen helped direct the child welfare policy portfolio at the Children's Defense Fund and co-led the Child Welfare Mental Health Coalition, an informal partnership of more than 200 organizations dedicated to child welfare reform. He serves as the co-chair of the Public Policy Committee at Generations United as subject matter expert for the Grand Families and Kinship Support Network. He was also a part of the coalition that was involved in pushing for these new kinship standards and instrumental in shaping them. Welcome, Stephen.
Thank you. Excited to be here with y'all.
Okay. And Jessica. So Jessica Bodell is a relative licensing and placement specialist for the Michigan Department of Health and Human Services with over 20 years of experience in child welfare in both private and public sectors. She's responsible for overseeing relative placement and licensure policy and as well as various relative initiatives and programming. And she serves as the statewide resource for relative placement and licensure. Jessica is also the Kinship Advisory Council lead and MDHHS administrator of Kinship Support Program, which is Kinship Navigator Services. Welcome, Jessica.
Great. Thanks, Felicia, for having me.
Awesome. And lastly, a quick introduction for myself, the moderator. As Adrian mentioned, I'm Felicia Yakir. I'm the co-founder CEO of Binti. I started Binti due to a personal connection. My sister went through the licensing process and it was really cumbersome and difficult. I've been a CASA for many years, and I started Binti with the goal of making the licensing process easy for families and social workers. In our 7 years since launch, we now do child welfare licensing in over 450 agencies in 35 states, including 10 states statewide, serving about 40% of child welfare in the country. We've helped approve over 100,000 families. So we're excited to be a thought partner to many agencies across the country in their shift toward kin first licensing. We've also recently launched Family Finding. So we're very focused as an organization on kinship right now and excited to be part of the conversation. Okay, so with that, we're going to jump into the conversation. We're dividing this into 5 sections. So the first, we're going to do a very quick overview of the new standards, the new kinship standards, and why they came to be. Then we're going to go into why are these new standards beneficial. We'll then spend a bit of time on how states have been implementing these new kinship standards already and how they're starting to do it even more. And then we're going to spend the most time on how can states go above and beyond the new kinship standards and create a truly kin-first agency. And then lastly, we'll open it up for questions from the audience. So we could definitely have a 3-hour discussion with this group on these topics. We did a bunch of prep and it was hard to wean it down to 1 hour, but we're going to be concise and move quickly and try to get through a lot in an hour. And we'll also make our contact information available at the end for any folks who want to follow up with any of the panelists. So for going to our first section, we're just going to do a few-minute quick overview of the new kinship standards, why they came to be. So I'm going to pass it to you first, Stephen.
Yeah, I'm sure this will be a quick review for most of you all, but I wanted to quickly touch on the rule leading to these standards. So this rule, which was finalized in September, gives states and Title IVE tribes the flexibility to create kin-specific licensure and approval standards for the purpose of Title IVE. Prior to this rule, states and tribes were required to have the exact same standards for kin caregivers that they had for non-kin. And that meant that Title IVE agencies couldn't adjust their standards to meet the specific needs and context of kin caregivers. And that in turn meant that thousands of children were not able to be placed with kin, and that thousands more were placed with kin who did not receive the same level of equitable financial support that's provided to non-kin foster parents. So now, with the rule, Title IVE agencies are able to create kin-specific licensure standards that meet those needs in that context. And importantly, the Administration for Children and Families explicitly encourage states to keep those standards only to what is required in federal law and to not add additional barriers to licensure for kin. There are only 2 things that are required in federal law for licensure. The first thing is a criminal records check, including a fingerprint-based background check of the FBI crime databases. It's important to note that there is only a very, very limited list of crimes that deny licensure, and states should not add other barrier crimes to that list. The second thing is a check of the child abuse and neglect registry maintained by the state, and also by any other state that a prospective foster parent has lived in for the last 5 years. And that's it. Nothing more is required for licensure in federal law, and we and ACF urge states to stick just to that. Under the new licensure rule, licensing and approval standards need to be reasonably in accord with the recommended standards of national organizations, but those did not exist for kin. And so I'm going to pass it over to Marina, who is going to speak a little bit about the process of devising those.
Thanks, Stephen. So we spent most of last year working with nearly every Title IV agency and well over 100 kinship caregivers to really understand what requirements around safety and needs assessments did families need and would help them get the assistance that they needed to give the kids in their care permanency and safety without putting undue barriers to getting financial support or placement in the first place with kinship caregivers. And we are really proud of that work. We heard from most agencies that you don't have the capacity or the time to start from scratch at developing a new safety assessment for relatives or a background check form for relatives that is written in plain language, things like that. So part of the co-design was looking at every single agency's current forms and processes, both around licensing and around what many call an emergency kinship placement, which is what you're doing to place with kin, regardless of whether in your agency that kin may ever be licensed later. And we built sort of a loving Frankenstein's monster. We took the best of every agency and we combined it into new recommended forms and templates and policies. And then we ran these back with representatives from nearly every agency and lots of actual kinship caregivers to try to identify additional spots where maybe it was confusing. Maybe people didn't know what the word combustible meant. So we changed it, very small examples to very, very big examples. We are super proud of the model standards, but do want to note that feedback is still welcome as agencies are implementing them. And we hope that they provide the clarity and guidance and materials for agencies to adopt kin-specific licensing and approval much more easily. And we have a number of agencies that are piloting the standards now, which is pretty exciting.
Awesome. Thank you, Stephen and Marina, for sharing that. And thanks for all the work you did this past year to, push for these standards as well as develop those model for states to follow so that they can implement more quickly. And just as a call out, we will be sending out links to those templates that Marina is mentioning as a follow-up for this webinar. So everyone will be able to see those and ask Marina and Stephen any questions about them as well. Okay, moving to our next section, we want to talk about why are these new standards beneficial? So to kick us off, I'd love, Kevin, for you to share your thoughts on that.
Thank you so much. I'm going to just start quickly, maybe what I would call a consolidation of learning, just to say why, there's a procedure here. We've got this wonderful work product from so many people on how to do the approvals, but let's talk about why that's important. And I want to start by contextualizing that in my experience, this is kind of remind people I've been around a long time. This story for me begins in the year 2000. I want to say something about why that was. In my experience in the year 1999-2000, what we were saying in the industry was this kid's got nobody, with teenagers drifting in systems disconnected. It was very common to say this kid's got no one. We even often said this kid has no father. In 2008, the Fostering Connections bills happened and the requirements for family finding were implemented. I would argue by about 2010, we had evolved from saying children don't have fathers and don't have families to saying, is this relative better than our foster parent? So we had this comparative way of thinking about, isn't foster care safer? Isn't there something about foster care that would be better than a marginal placement with kin? There's an attitudinal shift from no one to, is this better or is it not better? By 2024, by today, we see this really significant shift that I don't want to miss talking about. We have states like California and Virginia, too, that I am close to, that have expressly said their intention is to implement a kin first system. Why what's happened in those, over 20 years time. And the point I'm trying to make here is, one thing I'd like to say to this audience is, we're a system that's changing and growing, and it may be hard sometimes to see our change and our growth, but it's important to look back from time to time and see how we've changed and recognize that we're making progress. And this area is a crucial area of progress in terms of equity and knowledge and in our country. So what's different in 2024? One critical thing to understand is that there exists today a bedrock science, or what we call scientific consensus, that kinship placements for children who cannot stay with their parents are measurably better for them than being placed with people that are unrelated to them, and particularly better than being placed into congregate care settings. This is not a philosophical argument. It's not a belief issue. We have bedrock science of this. What is it about it? One thing that's worth thinking about and critical to our understanding is these family relationships with membership within your culture, community, and tribe are critically associated with protecting the development of children. They're developing brains, bodies, their the super system, their immune systems, their ability to feel safe relative to the world and be able then to participate in learning in school, learning skills by being active in their communities. These relationships are essential to their ability to do that. And children know the difference between relatives and strangers. I know this is kind of strange, but we even know that plants know the difference between relatives and strangers. There's good evidence for that. So it's beyond argument at this point, right? And it's why, when you think, why would the administration, prior to that, why would states like California and Virginia make this move? It's because the evidence is so overwhelming and compelling at this point. I'll add another piece. We now have, in the last 4 years, the availability of longitudinal evaluations looking at people by age 49 who had encounters with child protection systems and either went into foster care or group homes or directly into kinship care or stayed with their parents. And we're looking at what do they have to say about their health and their well-being by the time they're 49 years old. And in repeated evaluations, people who couldn't stay with their parent but went to kinship care had a 50% reduction in developing chronic or incurable diseases by the age of 49 relative to those who went into foster care or residential care. Again, what's that about? It's not about a discussion about bad foster parents or bad facilities. It's a fundamental understanding of how human health works, how child development works, and how crucial these naturally occurring relationships are to being protective to development and protective to health, even in family situations where people experience adversities. These relationships provide a kind of a buffer, what's been called in the science a buffer, or kind of a shield that kind of reassures children that things may be hard right now, but we're together and things will get better in the future. That's a very different context than being removed from that and placed with people you don't know in a system that can sometimes be chaotic. Finally, we look beyond health outcomes. We know the educational outcomes and even economic outcomes as adults for people who couldn't stay with their parents and went to kinship care are measurably better than those for people who went into foster care placements. And I'll stop there. I think those are a good start. Thank you.
Thank you so much, Kevin. Really appreciate those points. Jessica, do you want to share your thoughts on this?
Sure. So in Michigan, we are really looking forward to the increased access to subsidized guardianship. The new standards for kinship approval will allow us to officially approve kinship families without requiring the full licensure, ultimately improving outcomes through an increase in subsidized guardianship placements. There are lots of benefits with the new standards, but an increased access to subsidized guardianship is one that we are particularly excited about because of the positive impact that we know it will have on our kinship families.
Thank you, Jessica. Stephen, do you want to share about
Yeah.
why this is so important?
I'd love to double click on, the outcomes and things that Kevin spoke to, but also we need to understand that children's experiences matter when they are children, and we shouldn't just be thinking about children as future adults in here. It's really important when we think about the simple fact that young people want to be with family, that they want to be the sense of safety, of belonging that they get when they live with people who know them and who love them. As Kevin was saying, as others were saying, if a child can't be with their parents, this is the best option for children for so many reasons. But one of the main reasons that doesn't get talked about enough is that this is the best chance that children have of receiving the unconditional love that every child needs and that every child deserves. And we know that even when it is absolutely necessary, being separated from one's family and placed in foster care is traumatic. And we need to help children heal from that trauma. But as one of the young people interviewed for Think of Us as Away from Home report articulated, you can't heal from trauma while you're still going through trauma. And the child welfare system needs to look at how we can mitigate the harm that is caused, even in the best of circumstances, by family separation. The relationships that children have with people who know them and love them are the best protective factors out there for that adversity. And children heal and develop and grow in the context of their relationships. And these standards are so important because of how kinship care minimizes trauma and creates the safe, stable place for healing that children need.
Thank you, Stephen. Marina, do you want to add a quick comment?
Yeah. So everything everybody said about the impacts on children and families is obviously of paramount importance, but I do want to touch on some of the benefits that agencies have shared with us as well. Many agencies, not all, but many will be potentially seeing increases in their Title IV reimbursement for foster care maintenance payments if you have to date been an agency that's using agency funds to pay kin from placement. We also heard a lot about reduced administrative burden. So I saw a question in the chat that I'll address here. If you follow the new model standards, your kin will be fully approved at placement, if not very close to placement. The 2 time deltas will be how long it takes in your agency to get fingerprint-based background check results back and evaluate them. And if there's any necessary out-of-state child abuse and neglect registry checks. In some places, if you don't need the out-of-state, fingerprints can be evaluated within 1 or 2 days. At that point, your kin is fully approved. And we all know that retention and recruitment is a big challenge in our workforce today. And what we've heard over and over is that people don't become social workers to disqualify grandmas because they don't make enough money. That's not a fun job. That doesn't feel good. And that work, we hope, will disappear with the adoption of these new kin-specific standards. And then workers can help support whatever unique needs a family may have. They can help on prevention. They can help work on the things that they became a social worker to work on, and not administrative burden that hopefully these kin standards have eliminated.
Thank you for sharing. Okay, I'm going to shift us over to how states have been implementing some of this already and how they can start to implement more. Before I do, just closing off this section on why it's important, I just want to give a quick story that's actually one that Kevin shared in our prep for this. And I think we've all heard variations of this story in across the country of, a child who was not allowed to live with his grandmother. Instead of staying on her couch, which was not allowed at the time, he moved to 59 placements, and the state is now paying $1 million a year for supervision of this child. And I think just looking back, it's so clear that we should have figured out how he could have stayed on the couch with grandma. And I think we all have a lot of examples of those stories. And I think, as Kevin mentioned, the field is really shifting our mindset toward that. So let's shift to how states have been implementing some of these new standards and attitude toward kin first already, and how they can start to shift more. So Jessica, would love if you could kick off by sharing some of what you're up to in Michigan.
Sure, great, thanks. So because we know kinship care is better for kids and it helps them thrive, Michigan really started practicing the new model standards several years ago. We shifted our expectations and standards for kin to move away from licensing requirements and really focus on assessing for safety, providing financial support, and decreasing the number of children placed with unrelated families. So some of the steps that we took included modifying our placement assessments to move away from non-safety licensing standards and allow for opportunities to apply critical thinking and placement decisions. We shifted our narrative from requiring licensure, and we began providing full financial support to relatives from the time of placement. And that was not, and it is not, contingent on becoming licensed. And then we updated our statutory definition of a relative to allow for fictive kin relationships to be included as relatives. So all of those changes have led to an increase in the supports provided to our kinship families, as well as decreasing the number of children placed with unrelated providers, and therefore increasing the number of children placed with kin.
Thank you, Jessica. That's great to hear about. Marina, do you want to share some of what you've seen around the country in your work with agencies in terms of how folks are starting to implement these new standards?
Yeah, there are a bunch of agencies. There are 6 that are piloting right now, and there are an additional handful that are may as well be piloting, like they're just moving full steam ahead. And I would say every Title IV agency we've talked to has at least expressed interest and is starting some exploratory conversation. I also want to touch very quickly on what's available in the model standards. We talked again with every Title IV, nearly every Title IV agency. And if we didn't talk to you, I promise we tried really hard to talk to you. To hear like what were policy questions that you had, what were gray areas, and we really sought to get affirmative, clear answers, policy examples, et cetera. I saw a question in the chat. We worked a ton with so-called fictive kin, and we have a recommended definition of relative actually in the model standards that includes everybody that effectively has a relationship with the child or the child's family. So we really encourage using that definition rather than something about 5th or 3rd degrees of consanguinity that I can't even pronounce. And there's also, there's form templates. You're not required to use the templates, but many agencies have been really interested in them for conducting a safety and needs assessment, for a kin-friendly application form, right? We heard from so many kin caregivers in many cases that they had almost not become caregivers at all because they were so afraid of the background check process and of what all the different steps would entail. And so we designed a very plain language. I'm not saying it's gotta meet 100% of people's fears, right? We still have to have that human connection, but we removed some of the legalese and some of the jargon and made it clear of what the process will entail and what they should expect. And so we really encourage agencies to start from our templates, don't necessarily start from scratch. And again, they were developed all from materials that states have now, or states and Title IV tribes. So they aren't from scratch. They are a combination of the best from all of you across the country.
Awesome. Thanks, Marina. I love your human-centered design approach to this. And like we said, we will share links to what Marina is referencing in terms of the templates. Great. And I just want to give a quick comment and FYI before we head over to our final section around how we can go above and beyond the new kinship standards to be kin first. That, given at Binti, we work with about 40% of the country in child welfare licensing, we do feel like we're in a unique position to help agencies quickly pivot to these new standards and this kin first approach. So, many folks on this call work with us. So just want to give a heads up that it is a very fast, easy process to change your kin licensing process in Binti if you work with us. It doesn't cost anything. We can just do quick configurations. And if you decide to adopt, let's say, Marina's templates, you can let us know and we will quickly create a separate track for kin versus non-kin in Binti. Again, we don't charge for it. It can take a few weeks. It's just a matter of a configuration. So just reach out to your customer success manager at Binti and we'll be happy to support you as your practice continues to evolve. All right. So moving on to how states can go above and beyond the new kin standards to create a truly kin first agency. And we wanted to save most of the time for this because it's, I think, the most exciting part. So Kevin, if you could sort of kick us off with your thoughts, would love to hear them.
Yeah, I want to start by talking about applying an equity lens to this opportunity. And I wanted to mention, on January 20th of 21, President Biden issued an executive order on advancing racial equity and support for underserved communities through federal government. It's a call to action for an all-of-government response to addressing historic inequality in this country. And we know that disproportionately families involved with child protection in the United States have face inequalities around economics and also inequalities around race and gender. And so one of the opportunities here, the story you told Felicia, the grandmother you're talking about happened to be an African-American grandmother. The young person was an African-American young man. We've got to look at the impacts of these historic policies and the disparate harms that they've done to people and do. And this is an opportunity to confront that and change that story going forward. And so it's important that we think about this implementation in that context. It's worth mentioning. I really want to encourage leaders to not be thinking in their minds that this is an opportunity to build up a new program area and keep operating the foster care system that we've had. And in addition, raises questions like, well, we're so busy now, how can we possibly find the time to do this new thing? This isn't intended to be the new thing that we add on. This is intended to be the new thing that we replace the old thing with. We want to begin to move away from using foster care and group homes and other kinds of settings, and we want to keep children and their families. I think to myself, Stephen, I'm thinking about Sixto's writing his op-ed piece in the New York Times a year or two ago about his own experience learning that he grew up about 56 miles away from a whole host of relatives who would have raised him and sent him to college, but he was denied that opportunity because they were treated as though they didn't exist. That just simply needs to stop happening in this country and elsewhere. And I just want to start there. Let's see. I want to add that we want to also, I think about an example of Los Angeles County in California, one of the largest jurisdictions in the world. They've been working on an upfront family finding pilot for 8 years in the county. They've now implemented in all 19 offices. And within 60 days of contacting a family in the county, 90% of children are living with a relative, a kinship relationship, or with one of their parents today. They've replicated that in 19 different implementations across the county, and have been sustaining that for 8 years. It gets us an idea of the possibilities here, that that kinship care is not a pilot specialty program that might help a few kids. This is truly something we have evidence to support can be a very positive change in the quality of these systems, and therefore the quality of justice that families face who come into contact with them. Finally, I want to talk about something we're not yet talking as much as we need to be about, but I think we will, is one of the barriers to kinship care, in addition to approval processes and equity issues, has been a tendency in the last 20 years to what I would call medicalize or pathologize children who are living in families who are experiencing distress. And so we bring them into foster care around claims around neglect or abuse, but very quickly transform them into people with DSM diagnoses. And we begin to think in terms of their need for programs, their need for services, that those services aren't in their communities, can't be understood by their family, therefore they need specialized placements. That is a threat to our ability to keep families together. We should be thinking, when we need to think about the healthcare needs of young people and the behavioral health care of children, we need to be thinking about how families access those things, staying together rather than needing to separate families to access those things. That's an upcoming challenge that we're going to face. So I'll stop there. Thank you.
Great. Thanks, Kevin. And then, Marina, would love for you to share your thoughts on how agencies can go above and beyond to be kin first.
Yeah, absolutely. I think another key to this puzzle that becomes a lot easier with these new kin-specific licensing standards and options is about what many people call kin finding, but Kevin very kindly reminded me in our prep that it really should be kin seeing, which I deeply agree with. I have had the privilege of joining many agencies as they've done red teams or deep dives on kiddos that have been in care for, over a decade, or were in group homes during the pandemic, and suddenly, the group home didn't have enough staffing and we had to find a placement rapidly. And a constant theme there was, a child who allegedly has no placement options for 8, 9, 10 years. You have a conversation with them and they're like, oh, I could go live with grandma. And you're like, well, how did we not see grandma this whole time? And I think there is so much room for opportunities for kin seeing in agencies. I run something called the Resource Family Working Group, which is a coalition of about 40 different child welfare agencies at this point. And a big thing that we've collected over the last few years are really practical, actionable kin finding things, whether it's, are you making sure that you're inviting kin to pre-planning meetings way before we're even talking about removal? If there's a question of safety or prevention or the family needs involvement, does mom or dad, are they really encouraged to bring a supportive adult along? Are older youth encouraged to bring a supportive adult along? I mean, Stephen and the work that you guys have done at Think of Us highlights so many stories where when a youth is finally encouraged and supported in bringing a supportive adult along, that supportive adult is like, wait a minute, you were in foster care, you're in a group home, you need a placement? Like, come stay with me. And nobody had seen that kin and activated that support. And those, I don't want to say that it's literally free to do that, but it is relatively free to do that in all of our systems. We put together a lot of different kin finding practices. I think there are 22 that got published as the Grand Families and Kinship Support Network, Technical Assistance Network, Kin Finding, and Kevin, I'm going to rename it to the Kin Seeing Toolkit. And each one has, from existing agencies that are already doing that process, it has an example form, example policy, example template, so that another agency can leverage it. And that ranges from, Frederick County, Maryland had these absolutely beautiful life books made and illustrated so that children can stay connected to their kin. And, maybe a placement isn't an option today, but maybe in 6 months they are and they're not seen. But to Kevin's point, like if they're in this book and everybody's reading this book and updating this book, we don't lose track of those supportive adults. To having so-called firewall policies from different agencies where, in order to make a non-kin placement, even if it's 2 o'clock in the morning, you need your supervisor's signature. And that has been an extremely strong behavioral change I have seen, because when you're calling your supervisor at 2 o'clock in the morning, they're going to ask some questions about how many different kin that you talk to. And so there's a whole myriad of supports in that regard that we really want to encourage folks to read and consider in their agency, whether you're a private agency, whether you're a county run, whether you're state, whether you're an individual. Many of them are things that you could adopt relatively easily and with relatively few resources or money. And we'll share a link to that, right, Felicia? Yeah, great.
Yes, we'll include the link. Yeah, you have some amazing things in there. So really excited for everyone to get to see them. Awesome. And then, yeah, Stephen, would love for you to share your thoughts on how agencies can go above and beyond to be kin first.
So many ways. I don't want to discredit these standards. These standards are hugely, hugely important, but they're also just one small piece of what it looks like to create a system that truly honors and values kin. And this is really a down payment on the much larger work of reform that needs to be done. One of the things we need to do is start about thinking about the fact that for every child that is being raised by kin in foster care, there are 18 kids who are being raised by kin outside of foster care. And if we're not thinking about their needs, we are dramatically missing the mark. That is not something that is wholly in the purview of the Child Welfare Agency, nor should it be. But there needs to be interagency collaboration between child welfare and every other agency and program that supports families to wrap around kin without the need for foster care. That includes things like improving economic supports through the TANF Child Only program, or kinship assistance programs like the grandparent caregiver program and close relative caregiver programs in DC, or the kinship legal guardianship subsidy in New Jersey. The Child Welfare Agency does not have full ownership or responsibility for this. Kinship care is not a new business model. Families have been caring for kin long before the existence of the child welfare system, and we need to be thinking about new ways that this system can be providing support to those families, not ways that we can be bringing them into the system. Building on what Kevin was saying, what Marina was saying, within foster care. We also need to be thinking about kin beyond placement, so that when we are seeing them, finding them, seeing them, a relative or family friend or a teacher who could not be a placement. So often the system's response is just to kind of move on and forget about them. We need to be thinking about how we can maintain and deepen those connections that young people have with their kin, regardless of whether they can be placement. They might not be able to be a placement, but they can be stability, they can be belonging, they can be safety, they can be love for a child that helps and supports them. And then we also need to be thinking about support for kinship caregivers, not just about getting them licensure. What does ongoing training look like? Not as a condition of licensure, but as a support that is provided further. What does comprehensive mental health support look like that can be provided for the child and for their kin family? Crisis stabilization teams, peer support programs, housing and education support, training and support for therapeutic foster care so that young people can avoid congregate care facilities. Legal support both for child welfare and for civil legal issues. As Felicia was saying earlier, we could talk for 3 hours about these things on the webinar, but there's so much that can be done, and these standards are really huge, but we have so much work to do beyond them.
Thank you so much, Stephen. And Jessica, would love to hear your thoughts.
Sure. So Michigan continues to look for ways to increase supports to our kinship families. We believe there needs to be more effort to provide increased supports and build that in as a part of the overall system. Support could look like more frequent touch points, more access to flexible funding to allow for tailored and responsive support that's based on the unique needs of each family. Establishing or increasing the kinship family's network of support services, and then promoting cultural competence within the agency that recognizes and respects the diverse backgrounds of our kinship families. So those are all things that we are, looking to expand upon here in Michigan.
Thank you, Jessica. And when Marina was sharing some of her tactical things that states have implemented, there were a few, Kevin, that you've talked about that I think it would be great, and we have a few minutes to share around like a report for leadership, court oversight, concurrent planning. So maybe you can share some of those as well.
Yeah, well, one thing I think is important that comes out from listening to all of you today is we need to see the difference between effectively the diligent search requirements that were enacted in the Fostering Connections Bill 16 years ago. That kind of one of the problems in retrospect of that is that the courts have held the responsibility of approving whether notices were provided and whether search standards were met, and that's not enough. There's a language that I borrowed from Isabella Wilkerson in her book, The Warmth of Other Suns, that talks about the great migration of African Americans from the southern states to the north and the west. And she uses powerful language of what she called invited but unwelcome. I think this new policy from the administration, these new standards, are an opportunity to reckon with what's been an unwelcoming experience for too many family members. If they aren't seen as a placement, they're not seen at all, but they're critical to the well-being needs of young people. From a young person's perspective, if you can put yourself in their shoes, as Stephen is saying, these are life-affirming relationships that are necessary for health and necessary for development. So simply treating relative searches like a diligent search requirement does not welcome people. It, in fact, excludes them. Creating approval standards that don't subject people to feeling like they're being investigated, feeling like they're being surveilled, but again, feeling that they're welcomed is a critical change. And again, we can't ignore the equity implications of this. Finally, one thing that has gotten in the way, and Washington State has taken an overt action in legislation to address this, was the use of a strict permanency viewpoint and the idea of concurrent planning. We found in Washington, and our legislature corrected this, that the use of concurrent ideas like concurrent planning were used in practice to disadvantage relatives. Again, it looked like a version of saying foster care placements are equal or potentially better than kin placements until kin are proven to be adequate. And this kind of tension around multiple plans moving forward involving foster parents towards foster to adopt, et cetera, just added to disadvantaged experiences, particularly for African American families and parents in Washington. Our legislature has now prohibited that under the law, so we have to actually treat relatives, in fact, like they have the preference that they are offered in state law. And that's a critically important step forward in Washington State's policy that I think other states need to consider. So thank you.
Thank you, Kevin. Yeah, I love that phrase around treating kin with preference. I feel like that is kind of like this overarching thing that if you kind of have that lens, it can apply to so many decisions that an agency
Yeah.
can.
Could I just say, it's really worth mentioning the people who have the first preference are parents, and parents should be treated like they have preferences.
Right.
And they should actually, there should be evidence of the preferences that they experience. And then to your point, where children are not for a time able to live with either of their parents, there need to be clear evidence that relatives were in fact treated as though they had a preference for placement rather than being in a context with commercialized foster care placements and agencies.
Great point. Thank you. Great. So I'm going to close out this section with just a few thoughts on how technology can support a shift toward kin first agency, and then we're going to open it up for questions for the last 12 minutes or so. So please put your questions in the Q&A, and we'll be getting to them in a couple minutes. So how technology can support the shift toward kin first. I mean, first of all, in the approval process, there's some table stakes things of, letting kin do their process online, letting it be mobile friendly for them, supporting them in multiple languages. Many of our kin are more comfortable in other languages in the process. Supporting kin with, customer support over email, phone, live chat in their process of getting approved and being very responsive to them. Those are all things that we currently help in Binti with the licensing process. Some things that are above and beyond that I think technology can support within the future, which are things that we're exploring for this year, but also just putting out there for folks to think about in their systems. This is not an idea I thought of, so I'm not going to take credit, but some states have pioneered this, and Kevin has talked about this idea of pods of kin going through the licensing process together for respite and also for succession planning. So I think in the past, it's a very cumbersome process to go through a licensing process. And so typically you would identify the primary placement provider, let's say the grandma, she goes through, and you had found, let's say I'm the grandma, Kevin's the uncle, Marina is the cousin. They were potentially open to it, but you kind of discard them and just go ahead with the primary placement provider. Now that the licensing standards can be less cumbersome, I think it's a really unique opportunity to say, let's have all three of them go through the process and all get approved together in a pod. And then maybe I'm the primary placement, and then Kevin and Marina can do respite. Now this child has multiple kin that they're staying with and having really good connections with. But then also, let's say I have a health emergency, or let's say, unfortunately, I pass away, which unfortunately happens given such a high percentage of kin caregivers are grandparents. Now this child has a really natural succession plan to go with these other kin that are already licensed or they're already doing respite. It's a lot smoother than if these people were kind of discarded a few years ago, we haven't talked to them, and then we reach back out cold. So I just think that's a really interesting opportunity to explore these pods now that the approval standards are so much lower. And then also, I know so many agencies are doing Kinship Navigator and, supporting kin with resources that they need, but I think technology can play a role. That's something we're looking into as well, of, letting kin request, financial or material supports online and get the support they need quickly and easily, and making that as little of a headache as possible for them so they can focus on supporting the children. And then I won't spend too long going into this because, I think we're mostly focused on kinship standards today, but, I think the shift toward kin first is taking, you know, family finding or kin seeing very seriously. And several folks on this panel are thought leaders, obviously including Kevin in this. But I think, you know, technology can be really helpful in finding more kin, doing bulk outreach, generating family trees, generating court reports. We recently launched a family finding module, and it's definitely our fastest module, you know, growing module we've ever had, because I think there's just such an emphasis on kin right now, which is really exciting to see. And I do think technology can also help with some of the best practices that Kevin and Marina talked about today. So for example, if you need a supervisor approval for a placement with non-kin, that's something you can enforce in your technology system, and something to think about. Great. So with that, I'm going to shift toward Q&A from the audience, and we have exactly 10 minutes for that, which is great. So let's see, Rebecca, if you can chime in with the question that you think we should. We've had folks answering some of the Q&A directly.
Yeah, sounds great. So speaking to a few themes of questions that we have here in the chat, a couple of folks have asked how this works in relation to out-of-state work. So with ICPC, or if a child is in a different state than the kin that they might be placed with, how these standards help with that, or how that ties in, if someone can answer that question.
I can take that. Our hope and belief is that if two agencies, excuse me, have both adopted the kin-specific model standards, that ICPC should become a dramatically faster and more efficient and easier process. We are having our first meeting on that on Thursday with a number of agencies, ICPC administrators, to kind of work through some nuts and bolts and make sure that our assumptions there are correct. But that is our belief.
If I can add one piece onto that, that only works so far as states are aligning directly to the standards. If you are adding more barriers onto the standards, then that further complicates the ICPC process. The thing that would be a benefit is if states are adhering as closely as possible, hopefully entirely adhering to those standards, to the requirements that are in federal law, and seeing any other pieces as a benefit or a service that is provided after licensure, then that aligns for the ICPC process.
Great, thanks for sharing. I think another thing we've in the chat a bit is just about having to be a Title IVE agency in order to approve kin with the new standards, and how being part of Title IVE or not ties into this, if anyone can speak to that.
Stephen's my go-to 4E person, but I think you have to be a 4E agency to be placing children.
I think this question's coming from a private agency.
Yeah. So if you're a private agency, you are, well, my understanding is that you have to follow your Title IVE agency's processes. Some private agencies add on additional steps, and we would want to discourage that in terms of part of literal licensing or approval. But of course, if you are providing additional supports for kin on an ongoing basis, we encourage that.
Yes, that. So as a placing agency, you would not be able to just adopt these standards. They have to be they would have to be the standards that your Title IVE agency has adopted, but you would be able to follow through with whatever has been approved for your Title IVE agency to do.
Great. One question from the chat was around what types of financial supports that we're seeing agencies provide kin who are not licensed, but a child youth is placed to avoid foster care. Maybe we can answer that question both for that, but also for kin who the child is in foster care. I don't know, Jessica, if you want to kick us off, and then Marina, if you're able to share what you've seen from other states too.
So in Michigan, our families that are caring through kin that are not licensed through foster care, we pay them out of general funds. And then I'm assuming the other part is we call them, as of right now, we're referring to families caring for kin outside of the child welfare system as informal kinship families, and they have access to some TANF funds, child only. So I don't know if Marina has something to add on that.
I mean, there are 29 Title IV agencies that provide either full or partial foster care maintenance payments to unlicensed kinship caregivers who have children in their care who are formally in foster care. Michigan has absolutely been a leader in this, of doing it effectively from day one for all of your unlicensed kin, which is awesome. In terms of if you are a caregiver for children who are not in foster care, as Jessica mentioned, in I think every agency you are eligible for child-only TANF, and there are occasionally kinship programs that can provide additional stipends, but that is a much, it is outside the purview, unfortunately, of the kin licensing standards and rule. And I think that it really varies wildly based on the individual location.
There
Just jump
are.
in. Oh, sorry, Stephen, go ahead.
Go ahead, Campbell. Go ahead.
I just mentioned California, I think has been a really nice example over the last few decades that in developing multiple pathways to provide economic support in kinship placements, given that different families may qualify or not qualify for particular programs. And so having some redundancy and paying attention to what may disqualify families has been important progress that California has made.
I would also point to there are several states that have created separate pathways for funding for, as Jessica was saying, for informal kin caregivers. The Washington, D.C. has 2 different programs, one for grandparents and one for non-grandparent kin. New Jersey has a program. There are others as well, but those exist as kind of models that can be built off of as well.
Right. One question that I thought was really interesting that came in is, do we see this new kin first standards expanding to include adoption standards? One of the reasons California moved toward the research family approval process was because some of the people, kin and non-kin, not being able to meet the standards of an adoptive home study when the child becomes available for adoption. I fear kin will be excluded from adoption if the adoption standards are not changed, leaving only the option of guardianship, which isn't always the best outcome. I'm curious of the panel's thoughts on this.
I just want to point out, I know it's kind of controversial, but we have a scientific consensus that children who can't stay with the parent fare better across the board when they're placed in kinship arrangements. We don't know that that's true about adoptions with non-related people. I'm not saying it isn't, but I would want to be careful about conflating this kinship placement with adoptions, unless you're thinking about kinship adoptions.
I think, I'm sorry, I read it kind of quickly, but I think he is talking about wanting to make sure kin are not disadvantaged from adoption if they kind of go through this process, but then they want to adopt.
Yeah, we've heard this as a concern because some people said, well, grandma may qualify as a foster care placement for 6 or 7 years, but then she moves to adoption and suddenly she doesn't meet those adoption standards. These are imposed by your agency and also need to be fixed.
That's right.
If grandma has had you for 7 years and suddenly she doesn't have enough square footage or whatever it may, like that makes me kind of angry, and we need to resolve those collectively.
I think it's, I mean, it takes some imagination here, but going back to something Stephen said, which is, I think 1 out of every 18 kinship placements involve with child welfare. We need to, the way I think about, we need to think about kinship care as a long-standing institution in this country that's played a critical role in providing for children from our founding. And it cannot be conflated with comparing it or thinking of it like we thought about our foster care system. These are entirely different institutions with different histories and different values, and but they intersect in increasing ways. And we need to think about the importance of that kinship care institution and the role it plays and the value it brings to our country.
Wonderful. Thank you. I'm gonna shift to our closing slide, and we will get the Q&A, and we will follow up offline with folks that sent questions that we couldn't get to. We have a QR code here, which includes the email addresses of everyone on the panel, and also the link to all the resources that Marina and others were referencing in terms of the templates. We'll also be sending that over email to everyone, so you'll have it in your email as well. I just want to thank the panel so much for the time today, and I want to thank everyone for joining me. We had over 600 registered attendees, so there's a ton of interest in this topic, and we're excited to continue the conversation of how we can continue to shift the country toward being kin first. So thank you so much, everyone. Really appreciate you joining us today and look forward to continuing the conversation.